I would be able to access all my health records more or less online, wherever I am, however I want, and to whomever I'd like to reveal them to.
Yes, I mean, the idea is that once you can access your health record, you can access better healthcare service, and you can also help the healthcare provider provide better healthcare service for you. And that's been the problem, because healthcare records are always held in silos consistently. So how do we put the patient at the core of healthcare records and healthcare management? Because treatment happens in the hospital, healthcare happens outside of the hospital. So we're trying to bridge that gap so you can save money and the burden of the economy on our health infrastructures.
All right. So let's now, look at the specifics, of COVID-19. And one of the challenges we know is the question of contact tracing. As we've seen from that story, we have people who are giving wrong addresses. Of course, this has a myriad of reasons as to why people would do that. But bottom line is to ensure that we are a healthier nation. So with Afya Record, would this help us be able to contact trace and find areas or, red zone, as they have been now called?
So, I mean, there's two things with contact tracing. There is structured, accurate data and unstructured, inaccurate, or loose data. And for you to contact trace anything, you either have to work with structured data, where you work with governments and the data that they have, or you assume that you work with people who you assume on good faith will give you accuracy of data. And that is not a very viable option without the first one. So what Afya Record does is because our platform initially was built around keywords and geotagging from last year when we started developing for our alert system before COVID happened. What the platform allows the government to do is we digitize the case investigation form from step 1 to step 5, which basically means from the day the person goes to get tested, so we base our philosophy on structured data first. From the day the person goes to get tested, when they walk in, their details is digitized. So from their phone number, every information about them. But the minute you enter the information about the person, their location, we can see a map that pops up. So we begin to see everybody that is getting tested in Kenya or in a particular county. So now you have visibility of the spread of the test in real time. Now, as that moves on to the lab technician who verifies that the person is positive or negative, again, the system shows you a change of color to either red or yellow. But now you can also see within the same visibility how many people are positive, and then you can begin to create more decision-making protocols around what do I do next? And because you can see your whole county, you can understand where the people have come from who have tested positive or where their movements are. Then as a county, you can now begin to create your own quarantine zone. So you can create a red zone, you can create different types of zones based on the data, the accuracy of the information. And the parameters that you want to set, could it be 5-meter radius, it could be 50 or 100. Once you've done that, it's called a virtual fence. Now, what happens is really simple. Somebody else has the application, I have the application, you do. When I hit that virtual fence, instantly the platform sends me a message that I've just entered into a high-risk location. Now, that is where you capture the imagination of the person, because the idea is for us to protect ourselves without necessarily, creating problems for our privacy. So once a person gets that message, you're sanitizing their mind that they need to be careful. They've just entered a real hot zone, which it has been established because of accuracy of data. A lot of people here have tested positive or have been tested or different parameters. Once the person leaves that zone, now we take the person and cluster them into a yellow zone. Now they're potential risk. So we can now track and follow the person, understand who they come in contact with. And those are basic stuff that you do. Understand where they've gone, who they've come in contact with, how they move from one location to the other. But the interesting thing here is that, like I keep telling to all the health practitioners, to manage any disease or any outbreak, you have to sequence the symptoms. And symptoms are keywords. That's all they are. Right. Keywords. What is the keyword here? So because we are sequencing the symptoms and the location, it basically means even when you've gone, and yes, I've traced everybody that you've come in contact with, the symptom still remains. In that location is still extremely dangerous. Right. So other people come in contact with that location, and we call them people who are not directly correlated or even indirectly correlated with you. Now, how do you track the consistent movement of that symptom? If you track the human being, you will only be able to solve some of the problems. So we call it location and human cluster. You track both of them, and the symptom is the bridge between the two, and that is what Africa does. And at the end, we've digitized that form for the government, the one that they use right now, and also we've also digitized the certificate, the COVID pass. So now, once I finish, they can push me my COVID pass to my phone, and somebody at the border control has a scanner, just a simple app. You don't need any hardware, and he can scan your pass, and he can see if it's a valid based on the validity of that pass. So you can just give him your ID number, he enters it into the USSD system, and within seconds, he sees if you're valid or not. But at the same time, you get a two-way authentication. You get authenticated, he also knows. So he can't tell you that, hey, I just checked you and you're not valid. And that's really it. And the other part is we just use it.
Yeah, okay, that in a nutshell explains how the app is working. But now question would be, one, is how do I have to go for a test for me to get the certification? Because if I'm only dealing with symptoms, then there are those who are symptomatic. And as a result, we may have a certificate with somebody who may be positive but has no symptoms so far.
Yeah. So that's why I said there's structured data, which is where we give the government a platform for them to be able to do this in a structured way. Places like Mombasa, where you have real problems, and this writing of information by hand causes tons of problems. You can't really understand what is going on. Then there is structured, unstructured data. Somebody can also have the app and then consistently manage their own symptoms or be self-quarantined, and you still use the same data as a government as well to still create what you call potential risk locations, because you cannot base your accuracy of information on what the population is just entering. Even Google said it. We assume human intent is positive.
Right.
Okay. But if you start from structured data, at least that you can be sure of, then you move into your structured data, and then you can correlate both of them. And so, okay, based on the unstructured data and the good intent of the population who are using the platform, we understand this, but based on the structured data, we know this for sure. So we can map this together and create different types of, quarantine locations across, the county or the country.
All right. Now, the other question, of course, that many would want to know is when we have this kind of a database, which is very personal, you and I'm sure know by now that, personal data is the new gold. Who is the custodian? Who takes care of this whole system? And how safe is my data?
So we launched with Telkom Kenya about 3 weeks ago. So we host our platform with Telkom. We are working with Microsoft. So we're working pretty much with everybody involved in the governance of data and the data privacy space. And we're also involved with the conversation to around data privacy, data management. But from a perspective of COVID, when the government needs the data to be able to access the information and for the platforms to work, then the data right itself also has validity with the government to be able to do this. But when you talk about personal health record data, I own my personal health record data. The data residency is one issue, data governance is one, and the custodian and the ownership. They're all different levels of issue when you come to data privacy. It's not just about, who owns the data, and what is the intent of the data at the time of ownership as well.
All right, and if I own that data, that means that I have full access. So in short, what you're saying is this is the data that I will have full rights and protection over via an app. So how do I access it? Is it just with my phone? Is it a PIN number? And how do I then share this information with, for instance, if I went to a doctor and they needed my health records, how would I, now transmit that record to them?
Yeah, so what we're doing is we provide our SaaS platform for doctors. This is the other side of our business. Our SaaS platform allows the doctors to manage the patient data and communicate with the patients, especially patients who have chronic illness. And we're working from level 1 to level 3, where all the data is lost. Now, in that, is I have the app where once the doctor finishes with me, the system automatically pushes my data to my application. So I don't have to ask them for my data anymore. Or I just have an ID, assume I have I don't have a smartphone. When I go to the next doctor that also has the platform, I can just give them my ID and they're able to access my data. But at every point in time, I consistently have right to my data. Now, within the application, there are what we call privacy and share options, where I can decide what I want to share with my doctor.
Right.
I can decide what I don't want to share with, and I can decide how long I want to share that information as well. So I consistently maintain ownership because I'm the custodian of my own data. And that data is in two sides. There's data that I generate myself, so how I feel, what is wrong with me, my medication, and there's data generated by the doctor or the hospital. So the hospital also has the right to be able to use that data to consistently give you better healthcare service. But you also have the right to own that data to access other types of healthcare service. And the data that you generate yourself, you then have a right to decide, do I want to give it to the hospital or not?
All right, and maybe you could also answer to us how important this would be, not just with COVID-19, but for instance, if you're traveling from, say, Nairobi to Bungoma and you happen to become unwell in Bungoma, the systems that we have right now with hospitals is such that the hospital in another county, other than the hospital that I regularly visit, does not have any record of mine. And therefore, they're beginning literally with no records. And sometimes it's important because they may want to know what's the history of maybe the ailment that I have. Is AFIA record, or are there ways that we can have a centralized data where if any hospitals open my file, they can now find the history, and as a result, I get better service?
Absolutely, good question. I mean, the problem with centralized system is because the healthcare system itself is very broken. So you have public health, which everybody talks about, then you have private health, then you have other types of health. So when you want to create a central system, when I go from public to private health, they're not linked at all, even from a. So what we're doing is when we create this SaaS platform that we give into all the health infrastructure, it doesn't matter if you're public or private health. The idea is that the patient information is seamless and it consistently flows through the platform. And then also, as a patient, if another hospital doesn't have the AFIA record platform and I've generated my data from a hospital that has the platform, I have it in my application and in my own MPOD, which is my own database. When I go to the next hospital, they don't have our platform. I can actually give them my data. I can give them where I start. I can share that information with them either via my app, and we're finalizing also via my own web portal. Say, okay, this is my data from the last hospital. When you finish, can I also collect this data and put it back in here and continue my journey?
Okay, and then of course, the question again would be, we've had very high security institutions, for instance, banks, hacked when you have an app that gives access to your account. Now, this is my health, so really want it to be as private as possible. How safe is my data?
Yeah, it's a good question. I mean, for us, one of the biggest things that we are spending a lot of funds on is cybersecurity, and we're working with some of the top cybersecurity experts in the world who basically provide cybersecurity for the likes of, NASA and a few other organizations to make sure that we can maintain the sovereignty and the security of that data. And part of what we're doing, which is our IP from a technology perspective, we do things called MPOD, where it becomes difficult for you to hack multiple levels of data. You can only just see what is called the description of the data, and the pod itself is the data of that individual, which is not visible because it's encrypted. But the description, you see that, but it doesn't necessarily tell you what the person is or how. So we are innovating quite a number of new cybersecurity technologies and also, blockchain technologies that allow us to secure information and also secure the prescription of that information and secure how that information is also stored. And that is probably our biggest strength with the global networks that we have and we're connecting with, to also work with folks around the world who are doing amazing stuff in cybersecurity.
All right, another area I guess one would want to know how, you're going to penetrate is the question of, it sounds very good on paper, sounds very good, to use your phone, your smartphone, but there's a question also of internet penetration, particularly in the country. And I would imagine this is not a product, or even apps that we use should not be specifically made just for those in the urban areas and able to afford. How would you then handle those who do not have smartphones and internet access?
So again, in the beginning, when we offer, at the minute, we're working across the country with the mission hospitals. So we're actually working down in the rural communities. So we're dealing with the problem of internet. We're dealing with the problem of access to internet in real time. We're working with people who are providing various levels of access of internet to this type of hospitals, but also for patients who live in those communities. We have a platform on USSD, a very minimal version of it on USSD, where they can also access that and can switch to me as well. But the key is, once I have my user identifier, it doesn't matter if I have a phone or not, my data will consistently flow through all the systems. The day I have a smartphone, I can then access my own data because it is already kept for me.
All right.
And if I can access the internet or the web, I can access the web portal of my own, where I can also see my data. So we are consistently, and we're in live situation right now, that we're dealing in the rural community. So we're actually not in Nairobi.
All right, so to simplify this in terms of understanding, it would be like having an email address, where that is your email address, regardless of where you are. The day you log in, you are able to access. Is that how it would be working?
That is the other simplified version if I don't have an app, or I just use my USSD in the meantime if I don't even have access to it. So we're looking at all the structural issues. We're working with folks who've done work in community healthcare. We're working with folks who've done work in, providing internet access, the likes of BRICS and other partners. So we're working with different types of folks as well to make sure that, and what we look at it is a collaborative effort of partnership. We do this, somebody else does this very well. How do we make sure that when we go to provide this, it makes sense? So some of the mission hospitals that we're working with the Sisterhood of Kenya, again, a lot of the hospitals are all over the country.
All right.
They're in Nairobi. So, and the patients we're working, what they're providing, again, people are all over the country. So we're dealing with all types of different types of issues, and we're learning, especially if you work from the level 1 dispensary to the level 3 hospital, where, again, there's very little data. Everything is in the book, pen and paper. So, but it's interesting. It's been exciting so far.
All right, and another area that maybe, I don't know whether your app would be able to take care of this, that we suffer in this day and age, and this is not just with COVID-19 generally, is the area of fake news. We have a lot of fake news that goes around when it comes to, our health, but it is amplified when we have, for instance, a pandemic. You'll remember that there was a time it was said if you take hot water, it, kills the germs on your throat, and there was all sorts of things going around. There is, you can take ginger and garlic, and that will also sort you out. Fake news. How do you deal with fake news with this app? Does that help in any area?
Absolutely. I mean, within the application, again, we have a portal where you have information that comes automatically from the likes of the World Health Organization or from the country. What's actually interesting, you said that we launched with Nandi County just about 2 weeks ago, our USSD platform for managing fake news within the county, where they actually, within that USSD, it is actually pushed by the county themselves. So you don't have to send SMSs to people. They don't have to just go to that, star 380, star 28, and you can actually see the news consistently from the county, and you can share it with anybody, and anybody can know where that information is. And the more they push that information, the more people understand that, okay, this is where I go to get my news about my county. So the same thing can be, this is where I go to get my news about my government. So if you don't even have the app, if all you just had was a Nokia 3210, they can still provide, the system still provides opportunity for your county or for your organization to make sure that they provide the right access of use for you. And the idea is that it's consistently there whenever you want it. And the way people send me SMSs all the time that I never read, then now I can just go there if I wanted to get the news that I needed from the accurate source. Again, it's also existent in the app. And so this is all part of, because again, when we started our business, we were invested in by our doctors last year, who saw what we were trying to do to solve this problem. So we were not building our business for COVID. We were actually building a platform that allows for integrated health solution, but also creating an alert system that allows us to also help governments. And this was because of my research into Ebola. That's actually where we started this last year. So we not just jumping on a bandwagon and building something for COVID. That's not our business. We're building systems that allow us to manage different types of diseases.
All right.
Manage this problem as well.
Okay, and as we wind up, John, there was a lot of information going around over the weekend and into the week on apparently, something to do with Google having, access to our phones, and they're snooping on us. And this being your forte and area of expertise, what would you say? I'm sure you probably came across this information. What would you say about can you clear the air of what that is all about? If I go to my phone right now and go to settings and Google, there's actually an application there written COVID-19 exposure notification. What is that?
I have the same thing on my phone as well too, but it's just exposure notification. What it does is Google are trying to help for proximity of information for us to be able to constantly manage and track this. But it only works if your government has applications that actually deal with COVID contact tracing. The system itself doesn't work on its own. It's interdependent on governments or organizations or countries having applications that manage COVID. So within those applications, then Google can pick information off the back of that, and also then using Bluetooth technology, be able to also set other people who have activated the Google notification about what is happening from that one person's app to another person who might not have the application. So it's not really, they're not snooping on you at the minute or telling you that somebody has COVID until, applications within your ecosystem that are solving that problem are now part of that network.
All right, and maybe all right, John, as we wind up, we are out of time, and maybe your closing remarks. Now, Afia Record sounds like a great idea and something that is, a great innovation. Is it already in operation? Is it something that is yet to be launched? Where are we on that?
So we launched with Telecom Kenya about 3 weeks ago. We're live in Nandi with our news management solution, and also they're going to start using it to monitor remote patients. We are live with a few of the mission hospitals that we're testing with right now, and also we are live with a few other hospital chronic disease partners, and we are talking to a few counties around our contact room. So we're live in our beta test fully in the market in a number of different places.
All right, thank you very much, John Kamara, for joining us this morning and just giving us insight to applications that possibly are out there that help us manage our health data, which is important, and of course, that being brought to the fore, particularly now at a time of COVID-19. John Kamara is the founder and Chief Inspiration Officer at Afia Record. And it brings us to 8 o'clock right here on Morning Express. We are going to take a break, but do